next step is going to be for us to have a discussion. And we'd love to get questions. It's going to be moderated by Jonathan.
Yes.
And again, while we're such a small group, and it kind of takes me, if there's for questions, we should use the mic since this is all being recorded.
Also, please feel free to move forward. We don't bite hard. All right, I'll get out of the way here. So before I start off the questions, if anybody has a particular question that you'd like to get out there, this is a broad topic. It's perfectly fine to ask what you think might be a silly question because there aren't any silly questions. Okay, I'll start off. Here we go. Let's see here. I kind of just called out emergency medicine as being a little bit behind and slackers. What do you think has been a barrier or prevented emergency medicine from taking more of an active role in environmental impacts and climate change up to now?
Silly question.
Let's see the socks.
I was holding on to that. Stuart's going to answer.
Clearly, it isn't a fascinating question. And just quickly standing back, the quick answer on the disposable versus not for all the OR equipment was what?
Oh, every single one of those studies showed that reusables had a lower environmental impact than disposables.
Interesting. No, I think, and I was wondering this while you were presenting it, I think part of our strength is our lack of schedule, but also part of the burden we bear is that we're unscheduled, and we're an OR, may have 24-hour operation rarely. For the most part, it's a 9 to 5 kind of thing, and it's much more constrained as far as what's coming in, so controlling for variables I would think would be a lot easier. You're the smart guy who knows how to do this, so I'd kind of toss it back to you. But I would think that just methodologically, it's so random. That's kind of our beauty and our strength as we deal with chaos and smooth the curve. But if I were trying to set up a research project, I'd imagine it'd be ferociously difficult.
Hey, Chairman.
I agree, and I think building on that same theme of our strengths and our weaknesses, emergency medicine is not bounded in the same way that anesthesiology is, either geographically or in time, and all these other things. And so bounding our activities, I would immediately think, well, I have to go to the hospital level. And going to the hospital level takes time and energy, and a lot of us actually do have connections with administration and at a hospital level or a system level, so that's a strength of our specialty. But I think it does increase the complexity substantially.
I think one of the general barriers is, even just in talking to hospital administrators, is that there's so many other important things to worry about, right? Like we have catheter-associated UTIs, we have high bounce-back rates, and this is just another thing. And I think part of the mentality of emergency medicine is like we deal with the fastest train coming, the thing flying towards our head. And I don't think we really see climate change as, it's a slow emergency, it's a long emergency, right? And so we're not seeing it as the patient crashing in the front room, right? And that's where our energy and I think our attention sort of philosophically goes, is like, what's the thing right in our face? So we have that sort of disposition.
I would also argue that because it's politicized, and I think that there are sectors within emergency medicine that are a little bit hesitant to try to engage in something that still is such a polarized phenomenon within especially our society. And I think that kind of inhibits people, and they're like, oh, I've had many discussions with emergency physicians, and they're like, oh, but I don't want to get into politics. And so it's the whole thing that this is not political, this is a public health issue. And so, again, that's what we need to do, is reframe this idea that this is not a political issue, this is a public health issue.
Okay.
I think going along with the framing, Renee, is saying, like, I think climate change is sort of this thing like, oh, in the future it's going to be really bad, right? Like 2080, it's going to be so bad then. But I think reframing and saying, no, this is happening now, and doing studies which demonstrate that when we see spikes because of heat waves now. We've been seeing them for the past several decades, and we can use that information to our advantage instead of making it sort of a burdensome thing, sort of reframing it and saying, like, look, we can do emergency medicine smarter. We can staff our EDs when we know it's going to be hot. We can staff our EDs when we know we're going to have high patient volumes. And so I think sort of using it as sort of framing it as we can use this as an advantage if we have better information, more than it's going to be an administrative burden to the people dealing with it.
To follow up on Renee's, just to ask a follow-up question, where do you feel like the political pushback in your career is coming from on that? Is it, because I was thinking, I was just asking Jay kind of under the table, you know, I don't feel like it is that politically charged. It obviously is on the national basis, but as far as resources we have at hand, I don't know, I was curious to get your sense of where you felt like we needed to push harder, or we were being constrained by political considerations.
At least for me, the statement was more from the engagement from emergency medicine physicians, and I mean, we're blessed to practice in Boston, right, which is a very, is a city that is not representative of, I think, the majority of locations that emergency medicine physicians practice. And I think, especially, you know, if we think about, I mean, we're at Society of Academic Emergency Medicine, right, but we're a very small subsection of emergency physicians nationwide. And I think the majority are practicing out in communities. You know, we talk about busy bandwidth, and, you know, they have a busy clinical practice. And so I think from that standpoint, you know, in their mind, trying to engage around this, especially if they live in communities where climate change is very much a political and polarized item, I think it's, you know, if we want to try to engage the specialty across the United States and not just the coasts, I think that's more where that statement stemmed from.
Thank you.
Yeah, go.
I was wondering if you could comment on the level of support both in academics and in other kinds of practice for people to do this kind of work, or whether it's truly something that would have to be based on basically personal interest and passion outside of other professional obligations, essentially.
I think it's variable. I think you'll find different hospital groups are much more, have a much more developed, mature vocabulary around these issues than others. And I think it in some ways it's serendipitous upon the leadership. Other places it's regional. It depends on who they answer to, and what's expected of that system. I do think it's still in that, and maybe Amy could respond as well, having a better sense of the landscape. But I think there's it's still very hit or miss.
I think Practice Green Health, which is our membership organization, we have about 1,100 hospitals engaged, but I think our reach with all our program is upwards of around 3,000 hospitals in the country with our food program and another initiative we have called the Healthier Hospitals Initiative. So there are 5,000 hospitals in the country, so a little more than a half are engaged in one way or another. And in response to what are I agree with Renee about the political conversation. I'm from Massachusetts. I'm just a couple of miles away from you, and I don't think it's so much of a political pushback I get, but it's not accepting the climate science, which surprises me. So I feel in my communications, I try to move it away from the climate science and really talk about the health and talk about the consortium and talk about the medical societies who are saying that this is a public health issue, so move it to climate, move it to health.
Wait, just to be clear, as we kind of built a systemic argument, do you feel like there are people around you who don't believe that CO2 is increasing
Yes.
in Framingham? Wow, that's
In
disappointing.
Framingham.
Yeah.
In Framingham.
No, I mean widely, that's
Yeah.
no problem. But in
Yeah.
Framingham, that's kind of like, wow.
Also, a lot of people, when they think about climate issues, like they feel sort of hopeless, and they get into their denial brain mode because they really don't know what to do at all. So I think some guidance with some hope and what to actually do would be very helpful to engage people who are not engaged.
Yeah, I'm going to piggyback on that. I really think that when you hear hear of an issue that has no solution, you don't want to, it's cognitive dissonance, right? You don't want to think about it. But sort of the work that we're doing, we talked about harm, practicing health, is to come up with the solutions. So you have to have hope to do something about it. I think that's a key element to success of this. But I do have a question for you, which is that what this messaging that you could create is powerful. I'm just curious, what should the strategy be to get this out there to all the EM docs?
And can I ask a part two?
As if part one weren't easy.
Exactly. One stun us into silence.
So what are we asking emergency medicine physicians to do?
I think
Is
you
there
gotta.
one ask? Is there multiple asks?
There's multiple asks. You got to hit this at all different sectors. From all, you have to storm the castle from all sides, and find the breach, and find multiple breaches. So education, research, clinical awareness, advocacy, all things that any mature subset of EM, is pumping on all those cylinders, and I think that's exactly our aspiration, and it should be.
I think one element, or one expression of that for an ask is endorsement on the part of our professional organizations of platforms related to climate change, endorsing all of those things, noting that the harms are proven and that there are solutions to engage. And that is de minimis from my point of view, but we're not there yet.
Close.
Yeah.
Where do things
My
stand?
question is, how can we, we have a platform as just being a physician, and how can you use, how can people best use that platform to even educate the public and getting them engaged, too? Because the general public is the key stakeholder, right, to actually change public policy.
One of the things that I've been doing is working with Citizens Climate Lobby, which is, they're citizens, they're not physicians, some are scientists, but they love having a medical doctor. Somehow, just having you in the room, and I'm actually working with them on fracking, which isn't quite my wheelhouse, and so I'm trying to learn a lot, but having a medical advisor or just offering yourself, I think I spend a couple hours a week helping them, but they just want to make sure they're saying the right stuff about health. And so, you could lend your expertise in small ways to already mobilized groups in your community and say, hey, and they would love to have anybody with a medical background come and just be there.
Has anyone thought about how to, there's all this, changing healthcare around population health. Has anyone been able to make a strong enough link between population health management and environment to engage key leader stakeholders to move a little bit regarding the climate?
Well, I'll answer both of your questions with one response, which is another group that I've been working with is Physicians for Social Responsibility, and they've taken on this issue in a big way. And, they have historical success related to nuclear disarmament and have applied those same methods to climate mitigation. And just the other day, before I came here, I was at a farmer's market in Seattle, and I was asked to sign a petition related to a citizens' initiative around a carbon tax in Washington. And I hadn't signed it yet, and I had intended to. So without even looking at the person who asked me, I was like, yeah, I've been meaning to sign this, thanks. And he's like, oh, hey, Jeremy. And I was like, oh, Ken. It was Ken Lindsay. He's one of the head people in PSR in Washington State. And he was out canvassing this farmer's market, and they had thousands of signatures. And I should have been out there with him. But I think it's a great group to cozy up with and support. And I do think that there's actually been quite a bit of work highlighting the health co-benefits of climate change mitigation, quantifying that, and pushing governments around it. It's not been as successful here, though it was successful before this administration came in, and it's certainly been successful internationally through WHO.
And real quick, sorry, just to address the educating the patients. I think we're a specialty that has a very captive audience with our patients, right? Our patients are sitting in our emergency departments for 4, 6, 8, dare I say, even more hours, correct? I mean, and that's different for most specialties. I mean, they may wait an hour, hour and a half in a waiting room in an office-based practice, but we have a very captive audience, and, you know, I think we could be creative about how to leverage that forum to really educate our patients. And again, if we came up with, you know, working with some of these national organizations, you know, came up with an easy platform that could be rolled out, then it'd be taking a lot of the, because we all don't need to recreate our own wheel, right, in order to do this. So collaboratively, you know, you have a group of educational items, and then you can just sort of roll those out in emergency departments. And I think just acknowledging, too, that we are, as a physician, I mean, we are scientists, but we have that human face of science. And I think the current age that we're in, we really are at a point where, you know, science is being labeled as mistruth, and I think we need to be better about trying to translate that and taking the science, which often kind of stays within its own wheelhouse, and translating that to the public in a way that they can understand it. And I think physicians have that inherent communication and the ability to translate that, unlike anyone else.
So one thing, I've had experience with working with policy over back in Texas. I was part of the Texas Medical Association. I was a delegate for the medical school there. And one thing we saw is that with, you know, as we mentioned, climate change is a huge topic. It not only encompasses healthcare, but also encompasses energy. We're spending more as a population on energy just to heat and cool our homes during summer and winter, respectively. So, you know, focusing on, like, you know, looking at this huge topic, how have each one of you, with your respective organizations, I know Dr. Sorensen, you mentioned that you're working with climate and policy over back in Denver. How are each one of you, you know, strategizing your organizations that you work with, in addition to SAEM, as far as like reaching out to special interest groups that, you know, have different interests within climate change?
I guess locally, starting back a long time ago, is a passion and interest in just something that seems self-evident to me, building a home where that would be comfortably exercised. And so Renee has stepped into something that's been a long-term strategic goal of ours, and has taken it and made it her own in a beautiful way. So part of it, I think, charity begins at home, and you build programs and you collect people who are smart, extraordinarily capable, share your passions, and let them run. And so that's part of it. And then I think part of it is finding other groups like, certainly SAM has been a very welcoming house for us in a lot of different ways, and other groups as mentioned. And there's, I think, an overwhelming network out there. And I think we're much closer to a solution than we sometimes give ourselves credit for. That things can be pretty dire and dour. But at the same time, we're a lot further along than I think we allow ourselves, and I think some kind of fortitude and good humor in seeing that, you know, this will turn out, and which side of the fence were you on when it mattered is going to be what's important.
And part of it is finding your village. You know, so I sort of started this in my own little head, teaching wilderness medicine, and then I found people at this table and some new friends out in the audience. And that's, you know, that really empowers you, because now you've got a critical mass, and you're able to show up at SAEM with a lot of ammunition to make a good case. And then other groups that are out there. So I've been working with, personally, and many here too, with groups like Medical Society Consortium for Climate and Health, which is where other the colleges are all kind of collecting around. A group at Columbia trying to organize medical or climate change curriculum for healthcare providers, things like that. So sort of finding the other groups where the gravity is coalescing around makes a big part of the strategy.
Mm-hmm. Yeah, finding the village. And I think also, you know, I've found partners who are interested in this type of material, even outside of healthcare, and they bring so many different resources that we don't necessarily have in healthcare. So I got together with someone who works in the Colorado Department of Healthcare, Finance, and Policy, and then she knew someone in the Department of Energy, and we got together and designed an initiative to basically make Medicare and Medicaid reimbursements tied to energy efficiency of hospitals. And so basically saying, well, here's an indicator, right? If you can reduce your energy by 3% each year, you get more reimbursement for each Medicare or Medicaid patient you take care of. And everyone was super excited about it, this great thing. And then we took it to the hospital administration, and they said, we have so many other problems to worry about, right? But, you know, the point was we had a critical mass of people in policy, you know, within the hospital who were interested enough to be able to even start moving these things forward. So I think sort of unsuspecting allies and finding your village in the larger community can really help gain momentum.
One of the things that I find very interesting about this topic, and I have from the very beginning, I think part of the reason I actually stuck with it when I first encountered it, was how comprehensive it is and how challenging and how many opportunities there are for having to think creatively with partners around both what the problems are, because the problems differ place to place, and then what the solutions may be. And my experience at two really different universities has been really interesting in that regard. That I came from a university and was trained at a university that was more conservative in the South, but actually had really outstanding sustainability efforts. And you could leverage those in a way that at my new university, which is very progressive, and politically there's very strong will for, it's very decentralized and not really that well organized around some things. And so it's just the translation of that interest is not there in the same way. And so finding ways to work agendas in different settings and leverage perspectives. And in Texas, you have Catherine Hayhoe, who's one of these really outstanding, she's an evangelist around climate change mitigation related to creation care and other things. It's a very different perspective than you are hearing today, but it's very effective, and she's in your backyard. And so it's really interesting, the people you meet up with and the things that they're struggling with and trying to advance the agenda.
Just to step off of that, it's the fact that, I mean, to this broad scope of this challenge, I mean, this is like inherently needs a true interdisciplinary approach. And I mean, academics especially, right? We're so siloed. And so to be, you know, you need a lawyer, you have to have a climate scientist, you need an environmental engineer. And, you know, while Jonathan obviously is able to wear an EM hat and an environmental engineer hat at the same time, there aren't that many. And, you know, we need individuals from the School of Public Health. And just thinking about the broad range of individuals we need to engage on this, I mean, it's a huge task, right? And it's going to mandate that we have creative ways to sort of reach across multiple aisles that really haven't been utilized before. So it's going to take a lot of creativity